For hundreds of years, the equine species has lived alongside man as both work and companion animals. But in terms of horses, it seems as though they become susceptible to just about every disease, virus, and parasite you can imagine, which is why it's incredibly important to understand how these equine illnesses function. Today, we'll be talking about one of the most common of the equine respiratory diseases, equine influenza virus, looking at its pathology, its epidemiology, as well as any clinical signs associated with it, and treatment or prevention options available. Now, before we can do anything about a disease, we must first understand what it is and how it works. Now, according to AAEP.org, equine influenza virus is caused by an equine influenza A virus, which is an orthomysovirus of the H3N8 subtype. An orthomysovirus is simply the name of the family of viruses that causes influenzas, and the type that affects the equine species is found nearly worldwide. This disease is highly infectious and can be spread by the aerosolization of particles that are either coughed up or sneezed out by an infected horse. Furthermore, the H3N8 strain is continually evolving by a process of antigenetic drift. This means that, like most viruses, its continual evolution makes it extremely difficult to combat once it infects a host. Now, as in any disease or virus, there are corresponding clinical signs that are representative of this disease. Being an orthomysovirus, or an influenza, its main site of action is the respiratory system, meaning that most of the clinical signs are representative of that, including but not limited to a dry, harsh cough, tracheobronchitis, pneumonia in younger foals, dyspnea, exercise intolerance, abnormal lung sounds, and nasal discharge. Of course, there are other clinical signs that have little correlation with the respiratory system, including inappetence, dull demeanor, pyrexia, ocular discharge, and even submandibular lymphadenopathy. These are just a handful of clinical signs associated with equine influenza virus, so be certain to take note of any odd behavior or physiological conditions your horse may be projecting so that the veterinarian can better diagnose your animal. Now, as in most diseases, one of the biggest concerns that a client may have is if the animal will survive. Fortunately, equine influenza virus has a low mortality rate, and most horses recover without any lasting adverse effects. The biggest issue is how highly infectious it is. According to an article published, Equine influenza virus, a neglected reemergent disease threat, a massive 1872 outbreak starting in Toronto in late September spread along shipping routes across the United States and eventually into Central America and the Caribbean, stopping in Panama, which had no equine population to support the spread of equine influenza virus. It is this, what is generally considered to be the largest epizootic outbreak of equine influenza virus, that makes the virus so dangerous, and why it is a reportable disease in 27 states. This is also the reason why it's incredibly important to monitor horses closely in group settings, as most cases of equine influenza virus are associated with the gathering of equines for equestrian events for things like rodeos and horse shows. Now let's assume you have a horse that has started to project mild clinical signs associated with the respiratory system. A rapid diagnosis of equine influenza virus is crucial to beginning treatment and stopping the spread. But how would you know if you actually have equine influenza virus? Now, presumptive diagnosis can be made of equine influenza virus in a group of susceptible horses with a rapidly spreading febrile disease accompanied by a harsh, dry cough. This, however, is an unreliable means of diagnosis, as several other diseases and viruses can present with similar signs. The only definitive means of diagnosis of equine influenza virus is through laboratory testing. Virus isolation has always been the treatment of choice for equine, or diagnosis method of choice for equine influenza virus, but has since been replaced by transcriptase polymerase chain reaction, or RT-PCR, or real-time RT-PCR, due to its speed of completion and sensitivity. Also, some antigen detection methods that are used in human medicine are now available for equine testing. Once equine influenza virus has been diagnosed, treatment must begin. Unfortunately, since it is a virus, its main methods of treatment are down to supportive care and are purely symptomatic. These treatment options include stall rest and being taken off of training and put on stall rest for 1 week of every day of fever, and if a fever surpasses 104 degrees Fahrenheit, antimicrobials or NSAIDs may be prescribed. Of course, the best way to prevent your horse from getting a disease or treat your horse for a disease is to prevent it from getting that disease in the first place. To that end, the two types of vaccines that are available are modified live vaccine and inactivated killed vaccine. Currently, neither vaccination option provides any significant advantage over the other. Furthermore, like most vaccine, it is not a guarantee that your horse will be immune to equine influenza virus. It is merely the horse's best chance of avoiding the virus when it comes around. This is incredibly important because, again, the biggest issue with equine influenza virus is how highly infectious it is. And if the 2007 or 1872 outbreak feels too much like ancient history, another outbreak occurred as early as 2007. According to an article controlling equine influenza virus, for more than 4 months during 2007 in Australia, the equine influenza virus spread over an area of approximately 280,000 kilometers, affecting horses in two states of Queensland and New South Wales, infecting a total of about 70,000 horses in over 9,000 properties. The direct cost of the outbreak response by the government were approximately $350 million. The indirect costs to the industry were far higher but difficult to estimate. It is this, again, that makes equine influenza virus so dangerous, and why preventing the disease is so important. And good biosecurity mixed with vaccination is the best way to achieve that. So, over the last several minutes, we have discussed how equine influenza virus is an orthomysovirus and that many of its clinical signs are representative of the respiratory system, as well as having gone into some of the historical outbreaks. We have also discussed that preventing your horse from acquiring equine influenza virus is the best means of treatment and that there are two vaccine types available, as well as having discussed what to do if your horse is infected. While it should not need to be said, most veterinarians and vet techs will tell you, do not wait until your animal is infected with a disease or virus to begin treatment. If the option is available, get any animal vaccinated, not only for their sake, but also to help prevent the spread of infectious diseases to other susceptible animals.